Hello and welcome to another episode of October Surprise, a podcast created for citizens by citizens in Pennsylvania's new 16th Congressional District. I'm Jim Roddy, a lifelong resident of Northwest Pennsylvania, and your host for today's podcast. A little bit of background on our podcast before we get going with today's interview. October Surprise features a series of interviews designed to educate listeners in Erie, Crawford, Mercer, Lawrence, and Butler Counties on key issues that face both our district and our two congressional candidates, incumbent Mike Kelly and challenger Ron DiNicola. On each podcast, we'll also discuss ethical leadership, which unfortunately is in rare supply in Washington, D.C. in 2018. We'll do a lot of talking today and throughout the month of October on this podcast, but our ultimate goal is action. For democracy to work, you have to participate. We can't be bystanders. We can't wait for somebody else to take action. So at a minimum, that means being an informed voter. You can help by sharing episodes of October Surprise with your family and at least one or two of your friends on-the-fence voters who live in our district. The ultimate action is to vote on Election Day. Let's surprise the special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again, put people first. Finally, I'm not a political veteran or a campaign strategist. I don't have all the answers, but together we're going to learn what's happening in our district by talking with elected officials, grassroots leaders, and extraordinary citizens from PA 16 in each episode. Our special guest today is Cindy Purvis. Cindy is a lifelong resident of Erie County, just like me, but many people know her from the Lake Erie Ballet, where she was general manager for 10 years, and they also know her from Soup du Jour, a downtown Erie takeout restaurant, which she owned for 5 years. Cindy also helped to start St. Patrick's Haven, a night shelter for homeless men in Erie, and she's helped educate our community about the scourge of human trafficking. She also currently serves as the vice president of the Erie County Democratic Party. Her specialty is healthcare. She's been a healthcare advocate for years. She's currently a board member for the nonprofit Healthcare for All PA, and for years she's fought for legislation that would provide healthcare for every Pennsylvanian and save small businesses money by easing their burden to be a provider of healthcare. Cindy, thanks so much for your time today. Welcome to October Surprise.
Oh, good morning. Thank you.
Great to be talking with you. So, Cindy, I introduced you as fighting for health care for every Pennsylvania, and also saving small businesses money on health care. Let's talk about both those topics, starting first with health care for every Pennsylvanian first. So why do you support the concept of health care for all?
Two major reasons. Number one is that this is America. Everyone should have access to health care. Everyone should be able to afford health care, not only because they should, it's a human right, this is America, we can afford this, but also public health. I mean, when people go to a restaurant or places that they have low earners, people aren't making a lot of money, their staff there, they need to be assured that those people are healthy and they're not passing on things. And when we have an emergency, a public health crisis, we need to be ready for it by making sure that everyone has access to health care. Also, the second reason is money. It is absolutely absurd that people, when they are seriously ill or injured, that they cannot work, that they don't lose the health care they already have, and also that people can afford to go to the doctor, to have their health needs taken care of, to be able to purchase their prescriptions. It just makes sense, and every other industrialized country in the world has universal health care for all of their citizens, so it's just absurd that we don't in this country.
Right. It's not exactly like the United States would be pioneers by figuring this out. Other countries are doing it and have better outcomes than we've had from a healthcare standpoint. Just if I could follow up on one point you brought up, the public health concept. I guess I never really thought of it that way in terms of, and we've talked about in other episodes of the October Surprise podcast about low wages and how folks can't miss work. And you're saying there's a combination of if somebody can't get the health care, they're going to go in sick, work in a restaurant, or work in some sort of customer-facing job, and that is going to be, damaging from a public health standpoint. Is that kind of what you're saying here?
Oh, it absolutely is.
Got it. Thank you. So before we get into the second part about saving small businesses money, what are the viable options to achieve health care for all? What are the things that are on the table? What can our representatives do? What can our government do to accomplish that?
We have, in the state of Pennsylvania, we have legislation that's been introduced in the House and the Senate. And please know that our goal at Healthcare for All PA is not to stop there. It is to prove it can be done in a state with a large enough population as Pennsylvania to use as a template for the rest of the country. And this is how Canada did it. Canada first started with Saskatchewan. And when everyone saw that it worked, then it spread throughout the entire country. So that's our goal. There currently are 20 states people working in those states on a single-payer / Medicare for all health care plan, a universal health care plan. So we need one of those states to actually pass this so that we can see, Americans can see how it works and be comfortable with spreading it nationwide.
Okay, I've never heard anybody pattern anything after Saskatchewan, but that would be great, I guess. Pennsylvania needs to follow the lead of Saskatchewan. So you brought up Canada, and so I was going to ask this question later, but I'll bring it up right now. Can you talk about the objection that people have to, quote-unquote, socialized medicine or a government-run health care? Because when I hear the topic of health care for all come up, you hear people start sharing some anecdote or something about, you don't want to be like the Canadian healthcare system. So how do you respond when you hear that pushback to changing our current healthcare system? What data would you want to share with me and with our listeners about how things actually run in Canada and how they run in these other countries and why you think it'd be an upgrade?
Oh, thank you for that question. I've heard people say there's long lines in Canada. The thing is, there's long lines in America for some people. Some people will stand in a line until they die because they don't have access. Then there are others. I'll give you examples from my own family. My husband waited 3 months for a knee replacement. My daughter fell and tore her meniscus in her knee, and she had to wait a week for an MRI. If this had happened, if she had fallen in Canada, she would have had that MRI that day. They take care of their needs. People that have accidents or seriously ill, they're taken care of immediately. They just don't wait in a line. And then, yes, are some people waiting longer for elective surgeries or things like knee replacements? Sure. But Canada, everyone has a place in that line. Everyone is taken care of. So in America, it just seems that we're divided with all of this. And as far as socialized medicine, it all depends on where you live. If you live in England, yes, it's socialized. The doctors are employees of the hospitals. The buildings are the doctors are employees of the government. The buildings are owned by the government. Just like the VA system in America, that is socialized medicine. But in Canada, the hospitals are not owned and run by the government. The doctors are not employees of or told what to do in the government, by the government. It's just very different. And the thing is, with America being last, we have some advantages where we can sit down and look at all these other countries that have a universal health care system and say, what do we like from this? What do we not like for this? And to be able to craft our health care system to what we Americans think is the best for all.
Thank you for that. I appreciate those details. And it seems like whenever changes are proposed to the current healthcare system, these phrases like government-run healthcare, which doesn't sound good at all, are brought up. So there's a lot of fear. Like, I still remember 10 years ago when the conversations were about Obamacare and Sarah Palin pushing the death panels. There are going to be death panels. Like, I think every conversation she had or every speech she gave, she mentioned death panels. Well, Obamacare passed, and I don't remember any death panels. You know, it just seemed like more people got health care coverage. I guess, is that something that people need to be mindful of, are these sound bites, these fear tactics, these scare tactics, as opposed to getting the facts in terms of what health care for all means?
I think that's advantageous for Americans on a whole slew of topics, to not listen to these sound bites and to get the facts. The legislation that's been proposed in Pennsylvania is 36 pages. It's very readable. If anyone wants to go to our website, which is healthcare4allpa.org, it has a lot of easy explanations. There's people to talk to and study, and we welcome feedback from everyone. So I'm hoping Americans stop taking sides just based on those sound bites and start paying attention, because what's happening and what's coming down the pike is alarming. To think that somebody is trying to take away pre-existing conditions. I mean, President Obama fought very hard to get those in the Affordable Care Act. And that was so important to people, to lift the caps. Before the Affordable Care Act, there were caps where some people that were seriously ill, some children that needed lifetime of benefits for serious disabilities and illnesses, they had a cap. Once they reached that cap, they had nothing. So then you have pre-existing conditions. And the older people get in our society, the more pre-existing conditions there are. Mm-hmm. So they're kind of, it just seems to me that there are people that don't care about throwing all of these people under the bus. These people are us. They're our families. They're our fellow Americans, and it just seems very strange and disturbing that people don't want to hear the other side and look at all the facts.
And I want to dive into pre-existing conditions in a second, but first I want to talk about that second part about saving small businesses money. I want to get to that point first, because that's what a lot of folks think is, well, this all sounds good, but how is anybody going to pay for it? Isn't going to be a huge burden. So you're a former business owner. I'm a former business owner for 5.5 years. I had my own magazines here in Erie, and then I was president of a company here in Erie for 11 years, and our number one expense is payroll. Number two was healthcare, and healthcare had annual double-digit increases from an expense standpoint. And if we didn't have that giant growing expense, we could have paid people more, we could have launched new products, been more aggressive, grown more, hired more people, just all those things in general that help boost an economy. Can you talk about the healthcare burden that businesses are facing today, and then what can be done to lift that burden and, again, fulfill that saving small businesses money? Talk about that aspect, Cindy.
Yes, thank you, Jim. That's a great question. And I just want to give you one example. And people, this is a glaring example. In 2009, when the state passed the Right to Know Act, we were able to then go into all of our public businesses, our school districts, all of our municipalities, our county governments, and actually by filing a right to know, we were able to see what they were paying for health care. So as our bills are in Pennsylvania, families would pay 3% of their income for health care, which includes everything: doctors, hospitals, vision, dental, addiction treatment, all of that, and pharmaceuticals. All of that would be covered under our current legislation that's been proposed. So families would pay 3%. So if a family made $100,000 a year, $3,000 with no copays and no deductibles. So carrying this over to businesses would pay 10% of payroll. And so in our study of the public employers, the public employers on average were paying 26% of payroll for health care. So the Erie School District, as one example, would save over $12 million per year on employee health care costs, while every one of their employees would have comprehensive health care, and all of their students' families would have comprehensive health care. So when you carry that over to businesses, there were only, because as a business they need to release that information to us, but the few businesses I was able to get their information, it was running about the same, around at least 25% of payroll spent on health care for their employees. That's a huge chunk. When you take that down to 10%, there's all that money to use, as you said before, on giving pay raises, on product development, on doing all kinds of things to grow that business. And let's not forget to also be competitive in the global market. More and more, as Friedman said, the earth has become flat because of globalization. And those healthcare costs are so important. So we see some businesses, some large, car manufacturers that have moved a lot into Canada just to save that amount of money. Now I want to go a little bit into the really small mom-and-pop businesses. So many of them can't afford health care for just themselves and their families. So this flattens them out a little bit and helps them with those expenses. And also, they're saving more on our bill helps with workers' comp, because that would need to be changed, because all medical bills, if universal health care was passed as we in the bills that are currently in the House and the Senate, everyone would be taken care of. If you were injured on the job, no one's asking you for your employer's information. They're taking care of you. It's medically necessary. So workers' comp would only need to take care of lost wages and any liability. So there's all kinds of different savings that small businesses would also get.
Is there also, Cindy, we're talking about the dollars and cents of it, but it seems like a lot of small businesses, I know I get to appear inside a lot of smaller organizations, they're just not able to offer health care as a benefit, or whatever they offer, it's not particularly great because they just can't afford it, and so they end up losing a lot of employees to a larger company who has the wherewithal and the resources to offer health care. Do you see that as having an impact as well, in terms of, hey, you can work for this, 4-person organization, you can be their 5th employee, you're going to get the, health care coverage, as opposed to you got to jump to a big conglomerate to get the coverage that you want. Do you see that as an impact as well, if there's health care for all?
Absolutely, that's an impact. And also, let's talk a little bit about the employees themselves. I've noticed more and more over the years, people in very low-wage jobs, public jobs, customers, dealing with customers, teeth are an issue. And under this legislation, universal health care, dental care is a part of health care that for some reason our health insurance industry has tried and in many cases keeps out of health care. So all of those impact the small businesses and the employees.
Yes, and people's, we're talking about everything, the self-esteem of people as well, to be able to get the care that they need. So now what you and I are talking about is improving the healthcare system that we have now. But the situation that we're facing is our current Congress has actually tried to reduce benefits and increase costs. And you mentioned earlier about the pre-existing conditions. And so, again, Mike Kelly is our current representative, and he's among those who voted to raise healthcare costs on workers in rural districts and remove pre-existing conditions. And if folks think it might just be a couple, there's a long list of them, but they include Alzheimer's, asthma, cancer, cerebral palsy, diabetes, dialysis, MS, organ transplants, Parkinson's, pregnancy, sleep apnea, among others. So I guess, Cindy, if you could share with me, it wouldn't be an overstatement to say if Kelly's reelected and his party controls Congress and the White House, thousands of men, women, and children in our community could lose their coverage. They voted for it before. John McCain gave it the thumbs down. But that could happen again if, Kelly and his party are still in control. Is that accurate for me to say, or am I guilty of fear-mongering with saying that, or is it more a reality?
Oh, I think they've proven that that's true. They have voted for this. And it's absolutely ridiculous. I don't see how anyone can vote for Mike Kelly just on the health care alone, because we all know people that have, if we don't have them, we know others in our families, our friends, our coworkers that have these pre-existing conditions. And how absurd not to cover any that you have mentioned. They're all needs in the community. And it's just absurd on many levels, not only the health care and the care of our families, but our businesses. I knew a friend of mine who's a physician in the Pittsburgh area that has two locations. They sat down one year to negotiate. As you know, every year they would negotiate the health care costs for their practice, for their employees, and one employee had cancer. And their current health care provider at that time, their insurance company, really didn't want them anymore. Mm-hmm. So they raised their rates so high, basically to say, go somewhere else and shop around, because we don't want to cover this really high cost employee.
Yeah, and I can say that is a reality where my prior, life as president of a company here locally, where we had multiple employees get pregnant and have babies in 1 year, and it's like, good, like you want to celebrate, and then at the same point you're like, oh, I know how the insurance company's feeling about that, and I know what's going to impact us next year. And like you said, to a significant degree, it just seems like folks are being penalized for getting pregnant, and which, again, we want people to have growing families and not have people try to make the decision of, I got to keep my family low because of my health care expenses. So pregnancy is one that jumps out on that list. Another one that jumps out to me is cancer, just because of how many people in our area are cancer survivors, but only because they received quality health care or they had health care coverage that allowed them to get annual checkups. So personally, I'm a 16-year cancer survivor. I had colon cancer, was diagnosed and had surgery and then chemo starting in 2002. But the only reason it was caught is because I had health care, and so I would go and get annual checkups. My father passed away of a heart attack when he was 52, and so I was in my 20s at the time, and I thought, man, I should probably start getting checkups just to make sure there's nothing else going, wrong from a heart standpoint. And during one of those annual checkups, got some blood work. My iron was low. Couldn't quite figure out what it is, but then long story short, it was the colon cancer. And so I was very fortunate that I could go and get surgery at the Cleveland Clinic because my health insurance provider covered that. Got chemo here at the Erie Regional Cancer Center, some of the finest people I've ever met in my life, the nurses who work there. But I realize if I didn't have health care coverage, I wouldn't have been getting my checkup, because I wouldn't have paid the money to do that. And so that's why I'm here today, because I was able to catch that early. And so it seems like, Cindy, we can all have our differences about what's the best way to address this healthcare situation, but I just don't see how we can say to one person, hey, you get to have full care to cure your cancer, and to somebody else, sorry, you have to suffer, or, yeah, you can get that medical care, but you're going to be bankrupt for years and have this, giant financial burden. Is that kind of the crux of what we're talking about? Of just, like you said, we're all God's children. We should all have the opportunity to take care of ourselves and live long lives.
Absolutely, yes.
Got it. Good. Yeah, I'm glad we're on the same page with that. So what should be done? We've talked about a few things. What can be done to overcome the challenges our community is facing with health care, and specifically, what should our next congressional representative do? We talked about what Mike Kelly's voted for, and what should our next congressional representative do? What would you want to see them?
What I think is so important is helping to educate. I mean, I don't think because we're so divided, just saying, I take a stand here and we need to do this, we need to go into the community, reach out to those small businesses and people, educate them, and then say, now what do you think? I am hoping that our next congressperson actually establishes a roundtable for small businesses and bring them in and say, what are your problems? What is happening? And what about this? And what about this? And give us your feedback. We have a documentary called Fix It, Healthcare at a Tipping Point. This documentary was made by a Pennsylvania business owner from Easton, PA. He is so convinced that a single-payer / Medicare for all health care plan would save our businesses, that he produced this movie. And this movie is a great primer on exactly what this type of system is and what it would do for our businesses and also help our families. So I'm hoping that our next congressperson sits down and establishes a business roundtable for just that. Help educate them, get feedback, and go from there. Because by just taking these solid stances, we are keeping us divided, where healthcare is something that at any point in life we are all going to need, and if not us, our families.
Correct.
So this is something that should be happening, and that's what I am looking forward to, and that's why I'm so excited to support Ron DiNicola.
And so talk about that. That was one of my last two questions. So why are you why are you supporting Ron DiNicola? Like, you might not agree with him 100% on the same health care program, but it seems like you're in lockstep that health care is right for every American. Plus, he hasn't accepted corporate PAC money, so he's not in the pocket of health care special interest groups. Why are you supporting Ron DiNicola for Congress?
Well, I've known Ron for a number of years. I've been very, very impressed of his work privately with the community college, which I have supported from the beginning. Ron sees education as a way out of poverty. So he's been working on that issue a lot, as well as pre-K. So there again, it's education as a way to reduce and eventually eliminate poverty. And we have such high poverty in our area. So I've been impressed by all of his work privately for these things. So I've sat down, I've spoken to him, I gave him the movie Fix It. I am certain that once he is elected, now he believes, yes, that health care is a human right, and everyone, all Americans, should have access to affordable health care. So as of now, he's really, really busy working to assure that people keep what they already have. That's a huge amount of work, getting elected and assuring that people can keep what they already have in health care, that they're not going backwards. We're not ripping health care away from people with pre-existing conditions. So I'm very happy with that, and I am certain, knowing Ron and his character and what he has already done for us citizens, that we will work toward universal health care. So that's really why I am supporting Ron DiNicola.
Well, and I also mentioned that he's not in the pocket of healthcare special interest groups, and part of the reason I mentioned that is folks might say, well, why would Mike Kelly be against, all these things that we talked about, from providing, healthcare coverage for all? And it might be as simple as follow the money. So OpenSecrets.org is the website for the Center for Responsive Government, and they said in 2017-2018, Mike Kelly received $156,000 from the insurance industry, so most of that from insurance political action committees. He's also received $73,000 from pharmaceutical or healthcare products political action committees, and $55K from healthcare professionals. So if you're scoring at home, totaling that up, that's $284,000 just in 1 year. So, I mean, again, follow the money. We talk about the influence of corporate money and special interest groups. That's got to be driving it. I guess I shouldn't conclude that. I guess, what are your thoughts on that, Cindy?
Well, absolutely. The more people are clamoring for a universal health care system in America, the more people are really demanding this. And as we see some of these primary elections, I mean, the election in Florida the other day was incredible, where a candidate for governor is pushing Medicare for all, which is a single-payer universal system. So the more they're doing that, the more the health insurance industry and big pharma are getting worried, and they are buying their legislators. And it is just unfortunate that this is happening, and of course it all depends on that. And I'd like to talk a little bit about the pharmaceutical industry as well.
Okay.
And you know what, I probably should go backwards a little bit, and because I neglected to say that under the single-payer Medicare for all health care system, the insurance industry would go away. In other words, there's no middleman standing between you and your doctor with their hand out in both directions. It's just you and your doctor. People now have the freedom to work with their doctors on their care. Their doctors don't have to hire a whole staff just to go to the insurance industry and ask, what procedures can I give this person? You don't need any approval from some bureaucrat sitting in an office. It's you and your doctor. It's finally freedom for your health care. So the big pharma is a major problem right now because they are charging Americans much more than other countries for the same products. And it's still illegal to go to Canada and buy your pharmaceuticals. However, and how ridiculous is that? How close are we? I mean, my husband and I just took a day jaunt up to Canada a couple weeks ago. Mm-hmm. So the thing is, how ridiculous is that? And that is because the pharmaceutical industry has so much power. Now, if you look at our VA system here in America, they are able to negotiate on behalf of all the veterans for lower drug prices. Now, when you look at the Medicare Part D that was passed about 10 years ago, there was a line written in that legislation that said the government is not allowed to negotiate for lower drug prices on behalf of all the Medicare recipients. Big Pharma put that in there. And the congressman who was in charge of writing that legislation, after that passed, left and got a job with Big Pharma, making, I believe, $1 million his first year. So big pharma is a problem here too. So what we need to do under our new system and what we need to get to is being able to negotiate for lower drug prices on behalf of all of our citizens, just like other countries and just like our own VA system does.
Right. There's a lot of money here at stake for some people. Some folks who are getting paid $1 million a year, or, somewhere in that neighborhood and their organizations, no doubt about it. Cindy, can we end on an upbeat note? You mentioned about going up to Canada. Can I ask, where did you go? What did you do? Hopefully it was for something fun.
Oh, it was. We went to the falls, and we continued on up into wine country, Niagara-on-the-Lake. It's beautiful there, in case anyone hasn't been there. We did a little shopping, stopped at some fruit stands, and came home. It was a great day.
It's funny that you mention that because my family took a quick trip a couple weeks ago to Niagara-on-the-Lake. They were having their Peach Festival. We went to the falls. We went to a play, and as we were walking to the play, we ran into Sherrod Brown, the senator from Ohio, and his wife, and talked to them for a minute on the street there. So how about that?
That's great.
Small world. Yeah, it was very nice. Took a minute to pose for a picture. The only downside was the person on the street who said they would take the picture for us put their finger over the camera, so you can barely see me, but you can see my wife, daughter, Sherrod Brown, and his wife as well. So yeah, he's a proponent for this as well. So
yes, he is.
All right, well, good. I wanted to end on that. So, Cindy, thank you very much for your time today, and then really for all your efforts, because you're not just talking about health care for yourself, you're talking about health care for others and reducing burdens on small businesses in our community. So thank you for stepping up and doing that. Really appreciate your volunteer spirit.
Thank you, Jim.
Our podcast today is over, but there's still more that we need to do. As we talked about at the start, for democracy to work, we can't be bystanders. We have to participate. You can help by sharing this episode with your family and at least one or two on-the-fence voters who live in our district, encouraging them to vote on Election Day, and then you voting on Election Day as well. Let's surprise those special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again, put people first. I'm Jim Roddy. Thanks for listening to October Surprise.